Crompton, are you ready to come back?
Ready.
Alright, how are you doing today?
I'm good. How are you?
Good, thank you. You ready to get started?
I'm ready.
Alright. We just need you to fill out this Part Q and this informed consent. Any recent tests shown that you have dyslipidemia?
That was one time, it was spring break, and the test came back negative.
Okay then. Dyslipidemia would show up in your blood work and it's an unfavorable imbalance in your cholesterol levels.
Oh, no.
Do you smoke currently or have you smoked within the past 6 months?
No, I do not.
Your heart rate? Good strong pulse. Checks out at 62. (116/72). Sounds great. Alright, ready to move on to the test?
Let's go.
What is wrong with you?
Let me tell you, we've got a 23-year-old football player coming in. You guys are gonna die. Yeah.
Oh,
Goodness.
gosh.
I hope I'm ready for this.
Crompton, come on through. This is Dr. Easy and her assistant Candy, or the intern.
Nice to meet you. I'm Dr. Easy. I'm going to be taking care of all of you today. Hi, Mr. Compton. This is where we're going to apply the electrodes for the Bruce protocol. Katie.
My mind's telling me no. But my body's telling me yes.
No.
Baby.
So you're going to go to your fourth intercostal space for B1, B2, right across on the other side of the sternal border. And we're going to go to B4, which is your mid-clavicular line, fifth intercostal space. B3 is in between B2 and B4. B5 is your anterior axillary line, fifth intercostal space. Really, Candy? And then B6 is your mid-axillary line, fifth intercostal space. You're going to have your wind leads. For exercising purposes, we will not put them on the legs. Put them right.
Is this normal?
You just relax. Let me take care of everything.
Looking forward.
Candy, so far you've already failed your first test. You didn't realize that I put the limb leads too far out and they're supposed to be mid-clavicular line.
She's still cute though.
Alrighty, we're moving into the stage 1 of the Bruce protocol. He's going at 1.7 miles per hour and we're taking him to a 10% grade.
Okay, and we're going to check your vital signs at every stage and then we'll increase, okay? You just let me know if you have any problems.
Will do.
We'll be staying here for 3 minutes. Alright, we're going to stage 2 of the Bruce protocol. I'm taking your grade up to 12%. And we're also taking your speed up to 2.5 miles per hour.
So what kind of changes in this EKG are you looking for with patients with risk factors, cardiovascular risk factors, to stop the test? Tachycardia? And changes in the T wave? What kind of changes? Depressions? Right. And tachycardia? Really? You're going to be tachycardic when you're doing an exercise test.
Oh, that's right. I think it's time for us to go to the next stage, though.
How are you feeling, stud?
So far, so good.
You sure can go for a long time.
If you only knew.
Okay, we're taking it to stage 3 of the Bruce protocol. You're going 4.4 miles per hour and a 14% grade.
160/82 for his blood pressure, and his heart rate is racing at 150.
And we are taking it up to the next stage of the Bruce protocol. We're going to stage 4 at 4.2 miles per hour at a 16% grade.
All right, college boy, let's see what you got. Feel.
Like a 10.
Like a 10. You look like a 10.
Now we are at your post-test blood pressure. We're back down to resting at 110/78.
That looks different on this EKG.
The QRS complexes look a little big.
Okay, what could that be caused by?
The left ventricle being a little big.
Okay, and that's from what?
Left ventricular hypertrophy.
And that usually happens with athletes such as him that go through a lot of aerobic and resistance training. And also, what else could affect heart muscle enlargement?
I'm thinking steroids.
Yeah.
So
He probably, if he's not on them now, then he probably was at some point, maybe in high school. So, what do you think about that?
I think it's doing him a whole lot of good.
So do I.
Hey, what you doing running the elevator? Don't you know it's bad for your health?
All right, Betty Lou, you ready to go?
Yes, ma'am.
All right, ma'am, I'm going to need you to go ahead and spit out that fat for us. What? Yep, we can't do the test with that in there.
Giving me a hard time right from the beginning.
What are you here for today?
Well, my doctor's concerned about my blood pressure being too high.
All right. And do you have any family history at all, or?
Well, it gets a little complicated in my family tree. I don't know who my dad is. And my mom's a little overweight. She's about 450 pounds, so I'm pretty sure it has to do with something with genetics. I mean, it's got to count for something, right?
It does count for a little bit, but I'm sorry, we definitely can't blame it all on that, so.
Hi, how are you?
Howdy.
Okay, so I am Candy, and I will be doing your resting
All right.
measures today. We're going to do your ECG, and we're also going to do some blood pressure and heart rate beforehand, but tell me something.
What?
What's this you got here?
A little skull. Never hurt nobody. A little hair on your chest, that's all.
Okay, can we take that off so that we can go ahead and do your blood pressure? And well, it's a little high.
How much?
It's a little high, 140/80.
Sounds fine to me.
Actually, that puts you at a hypertensive state.
Oh, what does that mean?
That means that your blood pressure is not at a healthy level.
Okay.
So we're gonna make some lifestyle modification. So who is a grave digger?
He's a legend. How don't you know him? You ever watch Monster Truck?
Maybe on a commercial.
He's got it.
So Betty Lou, it looks like we're gonna have to do an EKG on you, but first we gotta get past the grave digger and
That animal that seems to be on your chest right there.
okay. I think we're going to go get the Chick 5. Well, Dr. Easy, we have our EKG results from Miss Betty Lou.
And what do we see that's going on that could be a potentially big problem?
Well, she's got some ST segment depressions.
Which is indicative of what?
I guess it has to do with ischemia, doesn't it?
It does.
We have noticed that in your blood work that we've seen, high cholesterol, and obviously earlier we found that you are hypertensive. So now that you're experiencing ischemia in your EKGs, we need to go ahead and do a Bruce protocol.
As soon as possible.
All right.